Sudden death syndrome in cats, and understanding why it happens. One of the worst things a pet lover can experience is the sudden loss of their beloved cat. Trying to understand why this happens is extremely painful. You want to make sense of what happened. Consider what you could have done differently, and determine if there were health issues you were not able to observe. It is most difficult to understand sudden death in cat when it happens to a young animal. There are many causes of unexpected death in cats. As we consider illness and death in cats, one important thing to remember is that cats are very good at hiding their illness as a survival measure. It allows cats to be sick for a long time before anyone is aware. This can be especially true for those who spend time every day with their cat and don't notice subtle changes like weight loss, shedding, sleeping more, or a dull coat. What are the possible causes of sudden death in cats? Number 1, heart disease. Heart disease may come with little to no warning sign. While some cats may have a history of a heart murmur, other cats can have no history of problems or abnormal symptoms. Cats with heart disease can develop difficulty in breathing, or they have difficulty using their back legs, which may result in them crying out in pain. While we have all heard of sudden death from heart disease in people, it is not commonly known that animals can have sudden heart problems that can also lead to death. Some cat owners will simply find their cats dead without any indication of symptoms. Number 2, chronic kidney disease. Chronic renal failure is a very common problem in cats. When the kidneys fail, they are no longer able to remove waste products that lead to the buildup of toxins in the blood. This produces clinical signs of kidney disease which include weight loss, decreased appetite, vomiting, and lethargy as the kidney disease progresses. Some cats with kidney disease will also have increased thirst and urination. This is most common in older cats but can occur at any age. Number 3, shock. Shock is defined as a profound life-threatening syndrome that results in low blood pressure and can lead to death. This can be caused by an allergic reaction, heart damage, severe infection, sepsis, trauma, blood loss, toxins, fluid loss, and spinal cord trauma. Cats with shock can die quickly, which may present as a sudden death. Number 4, toxins. Ingestion and/or exposure to toxins and medications is more common in outdoor cats, but can occur in indoor cats as well. Common toxins include antifreeze, potpourri, medications which contain acetaminophen, plant toxicity, and ingestion of rat poison. Number 5, blood clot. A blood clot, also called a thromboembolism, may be caused by many different health issues, including heart disease in cats. Blood clots can go to the brain, lungs, or blood vessels in the back legs, resulting in sudden death in cats. Number 6, infections. Severe infections, commonly known as sepsis, can cause a progressive group of symptoms including lethargy, anorexia, weight loss, dehydration, fever, and sudden death in cats. Number 7, feline urinary obstruction. Feline urinary obstruction, or UO, is an acute obstruction of the urinary tract, and although this disease can affect any cat, it is most commonly found in males. This is also known as a blocked cat. Typical signs are straining to urinate and crying. When untreated, most cats will die within 72 hours. Number 8, stroke in cats. A stroke is caused by the disruption of blood supply to the brain, which precipitates failure of nerve impulses to be transmitted from the brain to the rest of the body. The symptoms can come on quickly and cause sudden cat death. Signs of a stroke include difficulty walking, weakness, falling to one side, paralysis of one side of the body, and/or seizures. Number 9, heart failure. When heart failure occurs, it means that the heart is no longer able to keep up with normal demands and functions of the body. Signs of heart failure most often include a subtle decrease in appetite, less engagement in normal activities, and an increased respiratory rate. Some cats will be so short of breath that they will appear to pant with their mouths open, and cats will carefully mask their signs until they are in a state of fulminant and life-threatening heart failure. Number 10, heart attack. Coronary artery disease and blockage are atypical in cats due to the way that a cat's body processes consumed fats. Because of this, heart attacks in cats are extremely rare. When a heart attack does occur, however, it can be fatal. Symptoms of a heart attack typically appear suddenly. These symptoms include extreme weakness, lethargy, fainting or collapse, loss of appetite, vomiting, increased or slowed heart rate, heart palpitations or skipped beats, low-grade fever, inability to walk, seizures, hyperactivity, and sudden death. Number 11, high blood sugar in cats. Severe symptoms caused by uncontrolled diabetes can lead to weakness, lethargy, vomiting, coma, and death. Number 12, low blood sugar. Low blood sugar, also known as hypoglycemia, can cause lethargy, weakness, seizures, and sudden death. This can be an ill consequence of diabetes, from trauma, and/or various infectious diseases.